My name is Dana. I'm the advice nurse at Student Health Services. We are located at 425 Pearl Street, Burlington, Vermont, diagonally across from Gene Vance Hall. Our telephone number is 802-656-3350. Just like all of you, Student Health has been dealing with all the changes that come with COVID. So it's really important for COVID-specific changes to check UVM strong, your emails, give us a call if you have any questions. But due to COVID, our entrance has changed. So you may be instructed to access us through 1 South Prospect Street. That's near Waterman and across from the UVM Green. But just listen to your schedulers and your nurses. They will give you a clear instruction on where you're going. Student Health Services serves as a primary care home away from home while you are here at UVM. At Student Health, we recognize the wide range of lived experiences our students have had with healthcare and know that students have previously experienced racism, homophobia, transphobia, fat phobia, or ableism in previous medical care situations. We know that this happens in medical settings, and staff at Student Health strive to dismantle these biases. We recognize the work to dismantle this is constant, and we're always open to feedback. We are so glad you are here with us. So the start of the fall semester at Student Health is our busiest time of year for questions, even when COVID's not happening. This is the time of year that students are trying to figure out how to access us, things that they need to know for their health, and just to be on the lookout for. COVID certainly adding an added element to this, which I know at home everyone is working through this as well, but here at Student Health we are learning alongside of you, and I thought maybe we could take some time to look at our frequently asked questions and get some more information.
So what does Student Health do?
So at Student Health, we are a full-fledged medical clinic. We have medical doctors, nurse practitioners, physician assistants, a nutritionist, and a behavioral health provider. Actually, when you get to campus, you're assigned a primary campus provider to work with you. You can access that at your student portal. We'll talk about that a little later. As far as services go, we offer health maintenance visits and established care visits. So if you're bringing a medication from home, even if you've taken that medication for years, we want to have you come meet your provider and check in. Trans and non-binary healthcare, as well as STI testing, women's health, visits to discuss all birth control options, including IUDs, which is really exciting because the IUD program is a new program for us, nutrition services, behavioral health, and then just routine visits such as allergy injections and vaccines. You can also access an advice nurse to discuss medical questions as well. During non-COVID times, we still do have sick call visits. It just our face looks a little different right now. So you may have a telehealth visit, you may get a call to come in person. Just listen to your nurses and your schedulers on where to go. Some visits are outside, some may be at a pop-up clinic on campus, but we'll be able to tell you where you're going.
If I have a question, can I email you?
Great question. So actually we have a secure health portal that you can message us on. It needs to be a special kind of security so that it's all confidential. I recommend saving this to your desktop or on your phone. So if you go to mywellbeing.uvm.edu, you use your NetID to sign in. From there you can schedule appointments, request STI testing, and message directly with your provider if you have any health questions or need to check in around an ongoing illness.
So I don't have UVM health insurance. Can I still be seen?
So yes, if you're a full-time student, you pay what's called a comprehensive health fee. This gives you access to the clinic. So at the time of your visit, there is no billing of insurance or money exchanged in that way. We actually don't bill insurance at all. A lot of universities do that because our students come from all over the world. It would be impossible to be a network for everybody. So this comprehensive health fee gives you access to us. You come in for the visit. There may be some charges that are posted to your student account. So say, for example, you needed a strep test or something of that nature, we may post that to your account, and then you can print that off and submit it directly to your insurance yourself.
So my doctor's not here because I'm not local. How do I get my prescriptions refilled?
Yeah, so when you come to campus, you're assigned a primary campus provider, and what we want you to do for routine medications or chronic health problems is to call us and schedule an established care visit. So it may be a medication you've taken for years and everything's great and you love it, you're on the right dose, you're in the right place. We still want you to call us, set that up. Student Health is not a pharmacy, but we do have pharmacies located nearby to us on campus. So we share space with the hospital space. They have a pharmacy right upstairs from us. So when you enter our new entrance at 1 South Prospect Street, that's actually the address for the pharmacy, so you can find them upstairs. There's also one in the main hospital location on campus. But among other pharmacies in the area, there's a CVS on Dorset Street, a CVS on Church Street, and certainly let us know your preferred pharmacy. You can also request your prescription requests online through that My Wellbeing portal that we talked about. But you will need a visit to establish care. We can't prescribe it without seeing you, and by seeing you, it could be a telehealth visit as well.
You said you shared a space with the hospital. Does that mean that you're not connected?
So student health is on the ground floor of a building that's part of the hospital. And so the hospital system, UVM Medical Center, is the trauma center for the region. It is not student health. There is an emergency room on campus. It's located near Converse Hall. But if you are experiencing a medical emergency, we certainly want you to call 911 or visit the emergency room if you can. But if you're experiencing a minor illness, you have a health question, you're needing a medication refilled, that's student health. We want you to give us a call. And certainly if you have any questions about whether or not you should be going to the hospital, you can always call us. So there are situations that student health will direct you on how to use the hospital system. So because the hospital system is the trauma center for the region, it's also the laboratory services in the area. So if you came into student health and you needed lab work ordered, we would order it through the hospital system and direct you to one of their lab sites. So there is a lab located upstairs from us at that 1 South Prospect Street location, also in the main pharmacy. The other thing is if you were to ever injure yourself and you were thinking, oh, I need an x-ray, we want you to call us and make an appointment because you can be seen with us. We can give you the requisition for an x-ray and we can send you up. So essentially what that means is you don't have to pay for this big emergency room visit. All you're doing is getting your imaging done at the hospital.
If I have UVM health insurance, where should I go for information about what's covered?
So the mywellbeing.uvm.edu portal that we talked about, you can actually make an appointment online there to discuss your insurance with our insurance specialist. She has appointments in office and she can give you a call. Other thing you can do is call the number on your insurance card. So Wellfleet is the student insurance. It's a product of Cigna. Just call the number on your card and you can also check in about services covered there.
Can my parents find out my health information?
So no, for us to be able to talk to your parents, you would have to sign a records release. Certainly you can sign a records release if you would like us to tell your parents about a visit or to check in with them over the phone. But what we tell students is that when you sign this records release, it is only good for 12 months. You can take it back at any time. You can say, oh, I want this release out of my chart. That is definitely allowed. You can also kind of individualize the record release. So say there's a specific visit that you wanted us to tell your parents about, you can say just that visit. You can talk about that visit. But say, for example, you came in for STI testing and you didn't want them to know that, you can indicate on the form that you only want them to have access to a specific visit and not your lab results. If anyone has any additional questions that weren't covered today, please don't hesitate to reach out to us. Our phone number is 802-656-3350. Much like you, we at Student Health are dealing with the changes to what access to healthcare looks like, and we want you to know that we are here, we are present, we are wanting to see you. If that means via telehealth, talking to you on the phone, or getting to see you in person, we're excited about it. We know that this isn't the ideal start of a fall semester, but we're so glad that everyone's working through it and we are carrying a positive attitude as well. We cannot wait to see you at Student Health.